If you had to explain to anyone out who's listening, and you had to give like the elevator pitch of what QDoc is.
Sure, that's an easy one. We are Uber for medicine. So we match patients with physicians or nurse practitioners.
You've done that before, eh?
Yeah. And now I'd be getting off the elevator, so it'd be just perfect. That's basically, and that's basically what we do.
Yeah.
So the idea is essentially, like I'm looking at your mission statement right on the wall. It's to ensure that everyone has equal access to.
So we work within the public system. There are other virtual care companies that work within private or insurance, and they had to. It's the only way they could do it at the time. But the public system has come to realize, as I think everyone, that this is a good service to provide to the public. So as soon as they did that, that's when we built the company. And we really do try to ensure that there's equal access to quality care, for medical quality care for everyone. And so, of course, like everyone can access us. So people that live in Tuxedo and I pick on Tuxedo because that's where I live, but live in Tuxedo or River Heights or Linden Woods, whatever, can access us. But what we focus on is rural. Like when we do partnerships, we focus on the homeless, we focus on up north. So because of that, over 70% of the patients that we see are from rural areas. And even the ones that are in Winnipeg, there's a good chunk of them that are homeless because we focus on those. And we don't focus on, because everyone else can access us pretty easily. It's hard for some people to access care, and we try to focus on those.
What was that always the mission when you guys started, or did this adapt over time?
It pretty much was always the mission.
Yeah, I would agree.
There's always a mission. Like the mission is always that because it's something that's important to us. So, and also it helps bring people to rally around the company because we want to feel good about what we do. We know if we do good work, then the company will do well. We don't worry about the financial part of it, except for keeping the lights on. Like we have to worry about that part of it because of that reason. But besides that, we just want to create a really good culture and really good company. And because of the mission statement and our values that we have, I think we attract staff and we keep staff for sure. We don't have any problems keeping our staff, and they're really engaged. Like our staff, our investors, the patients that we see, they're super engaged on what we do. So it's exciting. It's exciting to hear that we've helped someone, right? In the community.
And I think it became really important that in building a platform like virtual care, that we built technology around it as a wrapper to ensure that the patient is matched with the right provider, right? That we are ensuring that in the event that patient needs to be seen in person, there's continuity of care. So all of the things that in the early days of virtual health kind of went to the wayside, we made sure that we built in leveraging technology, right, to do those things, and that typically results in a much better experience for the patient, right?